guys. Hello, you guys. Hi, good afternoon here in Ireland. Good evening there in the Philippines. Good afternoon in Saudi Arabia. So, hi, guys. Welcome back to my channel. Welcome back to my live stream. And I would like to welcome you all to this second episode of our RGN preparation. So, I know, inaabangan nyo to kasi marami tayong mga topics na i-discuss. But this is our second episode. And today we will be joined by someone who is very dear to me as well because she's been very Hindi na ako marunong magsalita, guys. She's been very helpful towards our newbies, towards our new nurses who arrive here in Ireland. She always helps those who is about to take the exam or who's actually just starting their application. So ngayon, guys, ipapakilala ko siya. She's actually nasa ano na siya, nasa baba na siya. I'll put her up in the mainstream now. However, I would like to know who are watching tonight. So if you can comment down below your location, kung nabay Bisaya dira, comment down below. Kung may Tagalog, Ilocano, Boholano, lahat na, comment down below. Ang hindi mag-comment, ano sabi ko? Papangit talaga kayo. Yan. So, please comment down below, guys, kung nasan kayo nanonood. And, diba, pinahaba ko yung intro. Hello sa taga Davao. Hi, Anise23 watching from Davao, and it's POV29 watching from Davao City. Hi, Janice, Joy, Holo, I mean, from Saudi Arabia. Wow, meron tayong mga watchers, mga nanonood sa Saudi Arabia. Hello kayo dyan. So now, guys, meron na tayong 13,000 million na, 13,000 viewers. So sa tingin ko, it's time to start now. We don't want to waste your time. We are here to learn. And in order for us to learn, I'd like to introduce to you our speaker for today. None other than, palakpakan kayo dyan. Magpalakpakan kayo dyan. Hindi magpalakpakan talaga, masasaktan sa akin eh. Guys, let's all welcome Miss Jeck Gonzalez. Ayan! Hello!
Good afternoon sa ating lahat. Good afternoon sa atin dito sa Ireland, and I think good evening na sa atin sa Pinas. And I think Saudi Arabia, sa atin hapon na rin doon. Hi, kumusta?
Oo. Hello, kumusta sa inyo? Actually, marami na nag-comment, Miss Jeck. Sabi nila they're watching from KSA quarantine time. Of course, si Nurse John Sia lagi ang active dito. Kathleen,
number one supporter mo ata.
Oh man, ayan, si Kathleen. Sorry?
Number one supporter,
ayan,
Nurse John Sia.
Oo, number one yan kasi hindi niya pwedeng ma-miss ito.
Hi, Nurse John.
Naman din, di ba?
Hello sa ating
lahat. Ng mga live stream. So guys, sige, gusto kong basahin ni Miss Jeck muna mga nanonood para naman, tayo, interactive naman tong ating, lecture today. Lecture talaga.
Hi, Miss Ivy. Miss Ivy Archua, hello. Kumusta? Sana may makuha kayo ngayong araw with me. Ano pala to, Gail? International pala tayo, Gail. Gail, pang international ng beauty mo, Day. It's all over the world, Gail.
Marami. Sabi ko sa'yo, meron tayong 17,000 na nabudol ngayon. Ayan.
KSA.
And guys,
from Davao. Hello sa mga taga-Davao.
Yes.
Kathleen.
So daghan jud Bisaya karong adlaw. Miss Jeck also speaks Bisaya and myself too. So Na
Mga
laban
Bisaya.
Bisaya jud, kailangan
So,
jud.
pwede na po mo kinan to Bisaya
Oo,
diha.
mga Bisaya
Katubagon
jud
na
may
itong
mga
Bisaya.
bisdak dako. Oo, why problem? Anyways, you guys, without further ado, I think Miss Jeck talaga, no? Miss Jeck talaga,
Check
te.
ra.
Miss
Check
Jeck
ra.
is ready. Si Jeck talaga, si Ate Jeck, she's been helping others already. And I'd say, alam na alam niya na tong Waterlow and Skin Bundle. So, without further ado, I'll give you the floor, Ate Jeck. And if you could please share your screen to me if you're ready. Okay, just let me know.
All right.
And guys, if you
All
have
right.
questions, please put it down below and then we'll put it and we'll discuss it later. We'll just allow Miss Jack to discuss her topic today and then we will discuss your question later. Pero nga, Miss Jack, sabi ni Nurse John Cia, naku, patay tayo dyan, Jack. May patanong, sabi niya.
Kung ano ang trip ni Gail,
Sasayaw,
sasabayan
Jack,
natin.
today. Sasayaw din ba talaga? Ayan, guys. Sige, malalaman natin kung sasayaw. Ay, talaga, guys. Ayun na.
Oo.
Sinasabi ko
Sasayaw.
sa inyo, hindi lang yan nagtuturo,
Para
guys.
sa inyo.
Dancerist din yan. Ayan.
Dangerous and dangerous.
So, guys, magsimula na tayo, Miss Jeck. Yan.
Alright.
So, yung mga questions dyan, ibaba nyo lang. I-drop nyo lang sa mga comment section. And please don't forget to subscribe to my channel, to like this video. Okay? Like this live stream. Ay,
Yes.
Miss Jeck, wait lang. May special akong gustong i-greet mo.
Button to Gail. Yes, it will help a lot.
I-greet mo to.
And
I-greet mo tong nanonood ngayon. Watching from Lansdowne Gate. I-greet mo yan.
Yeah. Hi, Fides Laura. And kay Mads
Ayan. Housemate ko yan. Actually, nanonood lang. Nanonood lang sila from kusina siguro.
Si Harold Jan is our Harold from FM Vlogger.
No, this is a Hindi, iba yung kay Harold. Iba din to. We have too many Harolds actually. Pero si Harold, hindi siya nag-join ngayon. I think he's busy. Ayan. Pero active yan si Harold. Kada may live stream, active yan. Anyways, I'll give you the floor, Miss Jeck, if you want to start. Okay?
All right. So, guys, we'll be discussing today about the Waterlow pressure area chart. And I'm going to share my screen now, okay? And we're going also to discuss the SSKIN bundle. All right? So, we're doing this to help you prepare for your RGN PIN very soon. So, I hope na may makuha kayo today with us. With me,
excited
sila. And you'll learn from this how to fill up this form, okay? So, I'm going to share now the form of the Waterlow.
Sige. Habang nag-aantay tayo kay Miss Jeck, guys, merong channel si Miss Jeck, actually. Gusto ko sana, tulungan natin siya to hit 1,000 subscribers as well. Her channel is Sweeter Than Honey. Please don't forget to subscribe to her channel. At saka marami siyang tinuturo dun, guys. Yung akin puro NMBI, sa kanya variety, lahat. Coverage niya yan. Covered yan ng channel ni Miss Jeck. So, ayan na nga, guys. So, while waiting for screen share kay Miss Anne, Sweeter yan kanya just in case you would want, well, anong just follow nyo talaga, hindi mag-subscribe. Meron na tayong 20,000 play. And ngayon,
wait ha.
Talaga ba? Wait lang.
Sorry,
ayan na,
sorry,
nakapasok na yung screen mo. Wait.
Hindi masyadong technical,
wala.
guys.
Ayan.
Sorry.
Kapit lang, guys.
Ito na. Waterlow.
Sabi sa inyo trying hard. Pero para sa inyo.
Kita ba, Gail?
Ayan. I-add natin sa screen. Ay,
Kita?
ayan na, Miss Jeck. Kita na, ayan na. Kita na.
Alright. So,
Ayan.
guys, so
Mhm. Ayan, ayan.
for your RGN preparation, so two of this what do you call this forms will come out. So it's very important that you will know how to fill up this form, okay? So we will start with Waterlow pressure area chart. So basically sa ano na to, sa station na to, or should I say sa preparation na ito, Waterlow is for it's like it's done during admission. And then SSKI and bundle is your implementation of care. So we'll start with the admission first, which is the Waterlow pressure area chart. So ano nga ba ang Waterlow pressure area chart? So this tool was developed to enable early detection of patients and clients from developing skin damage. So ito yung parameter natin, guys. Ito yung gagamitin nating tool or form para ma-recognize kung prone ba ang ating pasyente na mag-develop ng pressure ulcer. So, kasi dito sa Ireland, guys, malaking bagay sa kanilang pressure ulcer. So, iniiwasan talaga nila na while patient is on admission na mag-develop ng pressure ulcer. Kaya talagang highly implemented talaga nila tong Waterlow pressure area chart at saka yung SSKN bundle. So, how to fill up this form? So, first, as you can see, you have the name here. You can write the name of the patient. And then, these details, the date of birth, admission date, the ward, the diagnosis. And then, prior you start interviewing the patient, so you are going to of course, provide privacy for the patient first, and then you're going to ask for the permission of the patient that you are going to conduct a skin assessment on him or on her. And then you're going to provide privacy, close the curtain or close blinds. And then
Miss Jeck,
she'll be
so
treated.
I'd like to emphasize that one, yung sinabi ni Miss Jeck na essential sa kanila yung privacy, asking for permission
Yes,
na may gagawin kang procedure.
yes,
Eto guys ha, essential tip ito. When I say essential tip, you write it down. Guys, make sure that you ask for permission pag nag-procedure kayo, and then you explain the procedure to the patient. Make sure
yes,
may
exactly.
privacy, tsaka may
Yes,
permission kayo na gagawin yung procedure.
yes,
Yeah.
exactly.
Yun lang, commercial
Yes.
lang, miss.
Yes, yes, that's right, Gail. And we should not also forget our three, like after you introduce yourself to the patient, then you are going also to, identify the patient with the three identification, the name, the hospital number, and the name, the date of birth, and the hospital number. So now we say that the patient is seated already comfortably, and now we're going to uh, begin with the assessment. So, as you can see, you will already know immediately what's the gender of the patient. Let's say she's a female, so you're going to put here on this form as number 2. You're going to put the date, and then you're going to put here on this section female, so you're going to score 2. All right, and then we will move on to the age. So you're going to ask the patient, ma'am, may I know your age? Although it's written on the file, but of course, it is important to verify it with the patient. So let's say, I'll just get a pen, huh? So let's say, so I'm scoring, guys. Guys, try to score so that you can practice right now. I hope you have the form with you. So female, we have the score of 2. And then age, let's say the patient is 48 years old, okay? So we're going to score 1. And then moving on to height and weight. So guys, in here guys, the BMI will be given to you, or in case if the BMI is not given to you, then you should know how to calculate the body mass index. So body mass index is calculated through weight divided by height, which is kilogram over meter squared. So yun yung calculation ng BMI. So let's say the BMI of the patient, let's say it's 26. So you're going to write here 26 is 1, right? So you're going to write 1 on the corresponding column. And then, let's move on to the skin type. So, on this area, the skin type visual risk area, you need to conduct a full assessment on this. So, you're going to ask again your patient for a permission. Ma'am, is it all right with you to inspect your skin? So, kasi in this one, you ought to touch the patient. But given with the, with the pandemic right now, lahat ngayon verbalization lang, walang touching, non-touch sila ngayon, okay? So, but ideally, if we're working with a patient in the hospital, or whenever we are using this form in a real scenario, we are going to touch the patient's skin, okay? So, in this time, we are going to ask the patient.
I'd like to emphasize, sorry.
Yes.
Sorry, Ate Jeck, sorry. I'd like to emphasize that you guys, what Ate Jeck is trying to emphasize is that when you get to be on that situation na may mag-a-assess sa inyo. However, pag nasa practice na kayo sa ward or nasa nursing home na kayo, you can touch your patient, okay? So long as they have given you the permission. Baka mamaya, guys, hindi nyo naman nakawakan. Titigan nyo na lang. Hindi ganun yan. Pero yeah, go ahead, Ate Jeck.
Alright.
Baka mamaya kasi, ay, sabi daw ni Miss Jeck, 2 meter, 2 feet apart. Ay, tayo dyan. Baka mamaya hindi na nila hawakan. Oo, anyways, yes, ganun yan, guys.
So, ngayon na we already asked for the permission of the patient to touch the skin. So now we are going to ask, ma'am, is your skin healthy? Do you think that it's healthy? You feel like it's tissue paper? Is it dry, edematous, discolored, broken spots? So with this one, guys, if it's the visualization, if it's in the real scenario, you'll be the one to assess this one while you're also asking for the patient's kung ano ang tingin niya ngayon sa skin niya aside from the inspection that you did, that you're going to do. But in this time, you are just going to verbalize the patient, ma'am, may I know your skin type? Do you feel like it's healthy right now? Or you feel like it's tissue paper? Then she's going to answer you right away that, yeah, you know what? I think my skin right now is dry. So, pag sinabi niyang dry, ano ang score natin? 1. Okay? Let's say, pag sinabi niya
is it possible that you could zoom in the form?
Alright.
Pwede ba siya ma-zoom in, ate?
Zoom
sa taas, ate, yung magnify.
Ayan.
Yan.
Ayan. So, yan. Kita naman, no? Okay naman? Okay.
Yes, ate.
So, let's say a patient tells you, okay guys, fill up sa form ha. Let's say, nagsabi ang pasyente sa inyo, nurse, you know what? It's like a tissue paper. So, you're going to write 1. And then, she will also add, and it's dry also. So, you are going to score another 1. So, 1 and 1. Okay?
So, Miss Jeck, yung sinasabi mong i-scorean nila, lalagyan lang ba natin ng X sa gilid ng 1? Ganun
no,
ba yun?
hindi. Score mismo ang ilalagay natin. So, tissue
ilalagay
paper
mismo
1,
natin
so we're
ang
going to write
score.
there 1. Yeah.
Yes, yan.
Yes. And then dry, you're going to write also here 1, okay? Hindi siya X, hindi siya thick, but the number itself.
Mismong number. Oh,
yes, because
para klaro
we're going to total the score at the end of the form, okay? So, it should be in numbers, alright? And
klaro
now,
ba, guys? Comment down below pag hindi kayo masyado makahabol, ha? Dahan-dahan lang tayo. Pero sige, okay lang. Go.
Sorry guys,
pag naintindihan, comment down below. Pag hindi, comment down below pa rin. Sige.
And we will respond. We will go through with your comments and we will answer them all, okay?
Sige.
Sorry, medyo mabilis ba ako, Gail? Hindi naman?
Hindi naman, okay lang, Tessa. Sakto lang. Ako din, I'm learning. Kasi hindi rin, to be honest, I haven't practiced Waterlow pressure area chart before. Like, alam mo yun, because I'm in children. So, I don't know this. Kaya nga, I'm also learning again. I've studied this 3 years ago. So, ngayon, bago ulit. Yeah.
Alright.
Kaya okay lang, naintindihan ko naman.
Yes, sa akin din naman, I'm working in a community. And ito lang naman ay na-meet ko during the RCSI aptitude review lang din. And, kasi nga, lagi naman tayong tumutulong sa iba na sa pagpasa ba sa sa aptitude. So I'm quite like na-acquaint na rin ako kahit paano kung paano siya i-fill up. So but I'm not expert also because I'm not using it right now, but at least in our time during the review, it was thoroughly teach to us. Okay, thoroughly teach to us. So moving on, guys, with the mobility. So at this time, guys, you're going to ask your patient, ma'am, are you fully able to move by yourself? Do you need any assistance when you move? So you can ask them. And then restless fidgety, ito yung yung nanginginig siya. Do you feel are you restless right now or fidgety? Lethargic means do you have a little motivation to move? Lethargic. So guys, iisa-isahin mo siyang itanong. Ito, lethargic, it means do you have any little motivation to move? Pag restricted naman, guys, these are patients who cannot mobilize without aids or due to pain. So restricted sila. So example, the patient will tell you, you know what, nurse, it's hard for me to move and I'm actually on pain medication right now. So pag ganun ang response ng pasyente, so 3 na kaagad yun. So lalagay mo na ngayon ang 3. Let's say yun ang response ng pasyente, guys. Okay? So you're going to put 3, restricted. And then pag sinabi namang inert or traction, guys, ito na yung mga pasyente na bedbound, okay? Yung hindi talaga sila nakaka-ambulate. They cannot move on their own. They always need assistance. So sila yung bedbound, yung inert or traction. Tapos yung chairbound naman, yung lagi lang nakaupo, okay? So in this time, guys, it's not hard to assess the patient because she will tell you, she will verbalize, no, nurse, I'm able to move on my own independently and I do not need any assistance. So, kung ganun ang sinabi niya, so scorean mo siya ng 0. Pero let's say, sa situation ngayon, as I've told you, let's say that the patient is in pain and she cannot move without without the help of pain medication. So, ang score natin ngayon ay 3, okay? Restricted. So, moving on, I hope you're following, guys.
Naka-follow ba silang lahat? Na-follow niyo ba yun, guys? Kaka-concentrate nila, hindi na sila makapag-comment, nakatitig na lang sila sa form. Ano ba yun?
Oo, sige lang, titig.
Mag-comment kayo, guys. Kaya pa ba? Kaya pa ba? Galing tayo sa sepsis at saka news kahapon. Kaya pa ba?
Kaya yan, guys. Kaya yan. Kaya yan. Kakayanin yan.
Kaya yan. Sige, yan.
Kaya yan. Ating pangarap, kaya yan. Okay? So, we're moving to continence, guys. So, sa continence naman, guys, you're going to ask now the patient, do you experience any accidents or can you hold your bowel or urine? So, ang patient naman ay able to hold his urine or bowel and she can move, hindi siya nakakatai sa niya. She did not experience any accidents. So it means that it's complete. And if the patient is catheterized, meron siyang catheter, so it's 0 also. Pag sinabi nating, you can also ask this on this part if the patient is using nappy. Are you using nappy? Okay? So guys, sorry lang i-clarify ko lang. So as you go through this different category, hindi mo naman kailangan, okay, let's move on to continence. Diretso-diretso lang tayo, guys. So itanong mo na yung isang category, diretso na kaagad. Ma'am, how about your urine and bowel? Can you move them on your own? Are you able to go to the bathroom on your own without any like any help?
I-emphasize ko lang pala yung sinabi ni Ate Jeck na sinabi niya, it's called accident. Usually, guys, hindi nila sinasabi dito na, did you pass urine on your on your trousers or they call it accident. Like, have you had any episodes or have you had any accidents? Or like you can ask them if were you able to open your bowel? Ganon sila. Hindi siya yung have you passed stool? No, parang have you opened your bowel? Ganun dito. Have you
Yes.
passed urine? Parang ganun. And yun nga guys, just to emphasize
Yes.
the accident, baka kasi
Yes.
nagtataka kayo,
Yes.
anong aksidente? Bakit? Na ano ba? Vehicular
Yes.
accident ba? Na vehicular accident na siya,
Tama,
Zay.
tama. Correct. Correct.
Ayan. So,
So,
ayun
isa ito
lang.
sa mga, ano nila, mga, parang inaano
Slang.
nila na medical parang terminology nila dito na ginagamit nila. So, we're going to ask, do you experience any accidents? Can you hold your bowel or urine or pass them? Are you using nappy? So ngayon, sasagot siya ngayon sa'yo. Yeah, I'm able to move. I did not experience any accidents at all, and I can pass urine and bowel without any, like help of any medication or something like that. Okay? So, sasabihin naman niya sa'yo, guys, diretso, that I have occasional incontinence, or kung sabihin niya nakaka-catheterized siya, sasabihin niya diretso sa'yo, verbal. So, ang tip ko sa inyo dito, guys, pag naging vague, pag feeling mo, hindi mo nakuha kaagad yung sagot ng pasyente, ngayon, itatanong mo sa kanya kaagad diretso na, ma'am, can you please clarify it with me? Do you mean like, are you, you have a problem with your bowel or urine? So, ano mo kagad siya, guys, i-clarify mo kagad sa kanya kung ano ba yung sagot niya, kung hindi mo siya naiintindihan, okay? Pwede mong itanong sa kanya, pwede kang magtanong sa kanya, huwag kang matakot. Okay? So, ito namang doubly incontinent, guys. Ang urine and feces niya, hindi niya kayang i-expel ng sarili. So, doubly incontinent to, both urine and feces. Okay? So ngayon, let's say ang pasyente natin ay sabi niya, no, I don't have any experience of any accidents, and I can like move bowels and pass urine on my own. So let's say yun ang sagot ng pasyente natin. So ang score nun ay 0, okay? May dagdag ka, Gail?
May question pala ako. May question dito si Janice. Sabi ni Janice, ayan, lagay ko lang sa screen. Sabi niya, hello po, Miss Jeck. I would like to ask po about sa skin. Is it okay to score as many as possible? Like, for example, she feel niya na dry ang skin niya with discoloration, as we've discussed at kanina.
Yes. So, you can put, if discolored, you can put 2, and then, let's say dry, you can put 1. So, she will have a score of 3 here, but you will just put on the corresponding column 1, and then discolored 2, okay? So, it can be more than 1 ang sagot. Okay?
Ayun, ayan. Nasagot ka na, Janice. Comment down below. Satisfied ba tayo dyan sa sagot na, sa sagot ni Miss Jeck? Satisfied ba?
Okay,
ayan,
so
sige, Miss Jeck. Okay lang, tayo natin mamaya sagot ni Janice.
So, ngayon, move on na tayo sa appetite. I hope clear sa inyo yung continence kahit paano. So, complete means ang patient
clear
able
naman.
to open bowel on her
Clear
own.
naman. Sa akin na clear. Clear na siguro.
Okay. I'm sorry, Gail? I'm sorry, Gail?
I feel like naintindihan. Hello?
All right. Okay, so let's move on to appetite. So now you're going to ask your patient with the appetite, can you consume your food that is being served to you? Can you consume your food that is being served to you? So yun ang itatanong mo sa kanya. Tapos sabihin niya ngayon, you know what? Since my admission, I have a very poor appetite, nurse. So you can score 1. Pag sinabi naman yung average, sabihin niya sa'yo na, I'm all right, nurse. I'm eating well. I have no problem with, with my appetite. I'm eating well. Pag naka-NGT naman ng pasyente, naka-nasogastric tube, or naka-fluids ng pasyente, 2 ang answer natin. Or kung naka-nil by mouth or nothing per orium ang pasyente, naka-NPO, or may anorexia siya, we're score 3. So let's say, ang sagot ng pasyente natin dito, you know what, nurse, I've been eating so poorly these days since admission, so we'll score 1, okay? So now let's move on to the next page. So now we're here with the special risks, tissue malnutrition. Okay? So dito guys, basically, tatanungin na lang din naman natin ang pasyente natin dito. So, sa terminal cachexia, guys, ang ibig sabihin na ng terminal cachexia, it's muscle wastage. Okay? So, dito, basically, yung, wait ha, terminal cachexia. Meron ka bang ano nun, Gail?
Ilagay ko siya sa screen. Ayan. Terminal cachexia is a wasting disorder that causes extreme loss and muscle with loss of body fat. Sana lose ko din ang body fat ko. Sana all.
Ako din. Pero di ko wish na magka-terminal cachexia.
Ayan, sana all. Pero ayoko ng terminal cachexia. High risk for ano tayo dyan? Pressures.
So guys, ang ibig sabihin lang ng terminal cachexia in short term, muscle wastage. So, ang pagtatanong natin dito guys, we're going to ask, did you have unplanned weight loss for the past 3 to 6 months? Did you have unplanned weight loss for the past 3 to 6 months? So, yun ang unang-una mong itatanong sa pasyente, okay? Tapos, sa cardiac failure naman, sabihin natin, were you diagnosed before with a heart problem or heart disease? Tapos, sa peripheral vascular disease naman, you're going to ask the patient, do you feel any coldness or warmness on your feet or on your legs? And then sa anemia naman, you're going to ask, did you have a low red blood cell? Did you have low red blood cells? So then you're going to also add and educate the patient that the red blood cells is the one that carries oxygen to the body. So have you done this test before? Did you have any low result of your red blood cells? So yun ang itatanong mo sa kanya. Okay? Tapos, sa smoking naman, guys, of course, we'll just ask, are you a smoker? Are you smoking? Ganon. Okay? So, let's say, ang pasyente natin, sabihin niya, you know what, nurse, I had my, I had my full blood count checked the other day, and, the doctor told me that I have a low red blood cell. So, anong score natin ngayon dyan? So, scorean natin siya ngayon ng 2, okay? So, nag-score na tayo ng 2. Sana ba tayo?
Bale guys, ang na-explain lang ni Ms. Jeck is, kung sakaling tinanong niyo yung patient, kunwari kayo, nag-special risk assessment, kunwari nag-verbalize pasyente na, you know what, they actually have diagnosed with heart problem before. So, anong score niya ngayon kung cardiac failure is 5. So, ayun, guys. So, kunwari meron siya cardiac, yun yung 5. Tapos kung kunwari meron siyang, kunwari tinanong mo siya, you have, eto ha, lagay ko lang, katulad ng peripheral vascular disease, kunwari tinanong mo siya, do you feel pain upon walking, or do you feel any coldness or warmness on your feet? It means that probably your patient is having vascular disease. So then vascular disease would have a score of 5. So next to that one, you have to write 5. Nagets nyo ba? Nagets nyo ba? Please press 1 kung nagets nyo. Kung hindi, ay bala na kayo. Ba't hindi nyo nagets? Hindi, guys. Sige, pag may question kayo, lagay nyo sa baba, ha? Lagay nyo sa baba kung may questions kayo. Pero yun na, yun yung sinasabi.
Promise yan. Balikan namin lahat ng comments ninyo, okay? So, So we just, really, in this form, we just have to ask, the right questions, okay? So, now, we're moving to, so, ang sabi ko nga earlier, guys, ang pasyente, sabi siya na, may low red blood cell siya. So, ang score natin ay 2, okay? So, now, we're going to move to special risk and neurological deficits. So, dito, guys, tatanong naman natin, let's say, Gail, do you have any problem with your sugar? Do you have high blood sugar or low blood sugar? Do you have diabetes? Do you have
M
MS?
siya?
Yes, MS is multiple
Sometimes.
sclerosis. Okay? Sometimes.
Ayan.
Yun yung isip
Sometimes.
ko kalit.
Pag chine-check ko, tapos medyo sweet ako. Ganon.
So dito guys, basically ang ano nyo dito is na-diagnose talaga siya ng doktor. Hindi according sa kanyang perception, okay? So tatanungin mo siya diretso dito, were you diagnosed with diabetes? Do you have multiple sclerosis? Or ito naman si VA, yung cerebrovascular accident. Did you have stroke before? Stroke. So gagamitan natin siya ng layman, okay? So, did you have stroke before? Motor sensory paraplegia, ito yung do you have any paralysis on half part of your body? Do you have any paralysis on half part of your body? Parang ganun, okay? So, ngayon, sabihin niya, let's say sa'yo na, no nurse, I'm grateful that I have nothing of this diseases. So, ang score natin ngayon guys ay 0, okay? So guys, etong sa 4 to 6 na sinasabi natin, kung sasagot sila ang 4 to 6 na na scoring, it's for diabetes. Pag pag diet controlled ang pasyente, so 'yun, 4 ang score. Pero once naka-insulin ang pasyente, sasabihin niya sa'yo na, no, I'm on insulin nurse and I have diabetes and I'm actually on insulin. So ang score nun 6 guys. Okay? Pero the rest, ang multiple sclerosis, stroke, motor sensory paraplegia, ang score niyan ay 4 lang, okay?
Guys, nag-gets nyo ba yun, guys? Si DM lang ang 4 to 6. The rest would be scored as 4. Okay? Emphasize ko lang. Yan.
So, pag poorly controlled ang pasyente, poorly controlled ang diabetes niya at naka-insulin siya, 6 yun. Pag well-controlled naman by diet, so 4 lang yon. Ngayon guys, we're going to move with the special risk and major surgery trauma. So dito naman guys, tatanong natin kung Gail, did you have any surgery that involves your bone, orthopedic, di ba? Or did you have...
Mukhang yes ako dyan Ano score niyan? 5? Lang yan. 5 na ako agad sa Waterlow. Ano
high risk ka dahil.
High risk talaga.
So, tapos, below, did you have any surgery before that is below your waist or that involves your spine? So, yun. Ganun lang din ang pagtatanong mo.
Ako ata ang in-score ngayong
Kaya nga, di ba, sabi Sige lang,
ako nga talaga. Sige po. Mukhang bibingo ako ngayon. Bibingo talaga.
Mukhang 20 at ang score mo, Gil.
20 nga ata ako
Ngayon naman, guys, we're moving on to this one, the on-table trolley. Ito naman, ang pagtatanong nito, guys, sabihin mo dito, have you done any surgery before? And have you experienced, have you been to the accident and emergency department and you've been on the table or trolley for more than 2 hours? So, yun. Tatanong mo rin yun sa kanya. Okay? So, I'm sorry guys, just to clarify, ang pagtatanong pala nito guys ay, have you been to the A&E before and you've been seated or lying on the table or trolley for more than 2 hours? So, ganun pagtatanong guys. A&E.
Guys, hindi kasama dito yung guys yung, kunwari nag-antay lang sila sa A&E, tapos, walang beds, hindi kasama yun guys. Ang tinatanong dito, kung meron kayong treatment na na-receive yung patient, kung kunwari, meron silang minor procedure na ginawa doon that lasted 2 hours. Yun ha.
Tama, Gail. Thank you, Gail. Tama. So, okay na tayo, guys. Clear na tayo doon.
Yan.
Alright.
Ang dami palang Miss Ate Jeck. Ang dami palang mga special risk consideration,
Oo, ang dami talaga. Kaya talaga
mga underlying.
Yes. Kaya importante talaga sa kanila na well assessed ang pasyente nito. Kasi 'di ba malaking ano sa kanila, malaking bagay sa kanila na mag-develop ng pressure ulcer ang pasyente under their care.
Oo.
Oo. So ngayon naman sa special risk or medication naman tayo. So dito naman tatanong natin kung if the patient is taking any medication. So you can ask here, have you been taking any medication such as steroids or cytotoxics? Cytotoxics, these are medications that are used by like cancer patients. Or have you been taking anti-inflammatory or pain medications? Have you been taking pain medications such as Brufen? Then kung example, sabihin niya sa'yo na, yes nurse, you know what, from time to time, I'm taking, Brufen. So, lagay mo doon, one medical preparation yon. So, kada magdagdag siya sa inyo, every time that she will tell you medication, so, example, nagbanggit siya sa iyo ng 2 medication, so 2 medical preparations yon. So, ang score natin doon ay 2. Okay? So, kung gaano kadami yung tinitake niya, i-score mo yun siya bawat isa. 1, 2, 3, 4. Kung 4, then 4. Kung more, then 5. Okay. Kung 4 or more medical preparations, 4. Yun pala yung maximum. Okay? So, let's say, ang pasyente natin ay nagtitake nga siya ng Brufen from time to time. So, meron siyang 1. Okay? We score the patient as 1. Okay? Okay naman, Gail? Clear, Gail?
Oo.
Mm-hmm. So, ngayon guys, i-total na natin ang ating Waterlow. So, total na kayo dyan. Mag-total din ako ng akin.
Yan. Kasama din pala si Ate Jeck dito ngayon sa mga sasagot.
Kasama din ako dito.
Ayan, nagsuscore si Miss Jeck. Habang nagsusulat si Miss Jeck, shout out muna tayo ngayon. Shout out sa lahat ng mga nanonood na mga nurses ngayon all over the world. At saka sa mga manunood pa ng video na to na late dahil wala kayo ngayon. Hindi kayo makapanood dahil siguro it's either may work kayo or you have something scheduled today. No problem with that one. We'll keep this one on the YouTube channel so you could watch it and then rewatch it every time you have confusions or every time you have like clarification na hindi nyo masyado naiintindihan. Okay ba yun? Guys, don't forget to like this live stream ha. So yan, may score na ata si Miss Jeck.
Guys, sorry ha, clarify ko lang, parang hindi ako nagbigay ng scenario dito sa special risk. So let's say ang pasyente, she's been to the A&E and she received like a treatment for more than 2 hours. So let's say yun ang scenario ng pasyente. So plus 5 tayo, okay? So guys,
ngayon Miss Jeck, magsuscore na talaga tayo ngayon.
So ang total score natin guys ay 18. I hope 18 din kayo. Kasi 18 din ba? Akin.
So let's go back Miss Jeck para maka-follow sila. Doon tayo sa ano ba yung score natin kanina sa first part?
Okay.
The first part yung sa first page natin.
Diba yung first part natin, the patient is female, so 2 yun. Okay?
Female, so 2, yan.
Tapos yung BMI natin, as I told you, it was, I think, 26. So ang score natin ay 1. BMI. Tapos yung skin type natin, it was dry and tissue paper.
Tissue paper, oo.
So, 1. So, ilan na yun? Tapos, sa mobility naman, ang patient ay fully mobile. So, 0 ang score dyan, okay?
Tapos, continent.
Ay, hindi pala. Sorry, Gail. Ano pala ang score ko dito, Gail? Restricted pala, Gail. Sorry. Kasi ang sabi ko nga,
restricted.
Yes. She cannot move without any pain medication.
Ayan. So, restricted siya. So, score natin 3, Miss Jeck. Ano?
Yes. Tapos, ang continence naman natin ay 0 kasi able to move bowels and pass urine naman siya. Tapos, yung appetite naman natin, poor. So, ang score natin ay 1. Okay?
Ayan. Naka-follow ba kayo, guys? Na-follow niyo ba kung ano yung mga...
guys. Tapos, Sa ano naman, sa special risk naman, let's say ang pasyente natin, ang sabi ko kanina, anemic ang ating pasyente, may low red blood cells siya. So 2 ang answer. 2 ang score, I mean. Tapos sa special risk neurological deficits naman 0 siya kasi wala naman siyang any comorbidity na nabanggit dito. Wala siyang diabetes, hindi rin siya na stroke, wala rin siyang problema sa ano niya. So 0 ang score natin.
Ayun.
Tapos sa special risk or major surgery trauma naman, nabanggit ko na she had been to the A&E and she spent 2 hours there on while doing the treatment. So 5 tayo.
5 tayo doon. Oh.
Tapos, sa special risk medication naman, meron siyang 1 medical preparation which is Brufen. So, score tayo ng 1, okay? So, ilan Gail sa'yo, Gail? 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. 18 ang score ko, guys. 18 din ba sa'yo, Gail?
Yeah, 17. Bakit hindi ako bakit 17 ang akin, ha? 4, 5, 6, 7, 10, 11, 12, 13, 14, 15, 18 nga, 18.
18 tayo, guys.
18. May isa pala.
Na tayo, okay? So, 18. Ano yung score ng 18? So, that means ang pasyente natin ay high risk, okay? Ito yung scoring natin. So, lalagay mo ngayon yung score na total mo dyan, total score. You're going to put 18. And then you're going to affix your signature here, down. So, ngayon, ang pasyente natin ay high risk. 15 plus 15, over 15 siya. So, high risk ang ating pasyente, okay?
Miss Jeck, may question lang tayo dito. Sabi niya, ang capillary refill, ma'am, mag-fall ba sa vascular kahit wala pang diagnosed na any vascular disease ang patient?
Wala naman. And let's not overcomplicate. Let's not overcomplicate, guys.
Kung ano lang yung nasa form, guys, kung ano lang yung nasa form, yun lang yung i-assess nyo. Kasama nito, sabi ni Kathleen Garcia, how about the age po? Usually kasi, guys, adults na sa adults ginagamit yung Waterlow. So, kung kunwari, teenager sila, or I think, magpo-fall pa rin dito yung mga younger adult. Like, kunwari, yung lumagpas lang sila ng children. Kunwari, nasa 19 years old sila, tapos they are in the ICU, and alam mo yon, yung they are high risk for pressure ulcer, we use this one. Pero about the age, you just indicate the age of the patient there, pero hindi siya kasali sa assessment. Hindi siya kasali para mag-contribute na kung at risk ba ang patient.
And guys, just to remind you, sa ating mismong sa ating exam, walang children doon, lahat adult-based, okay?
Okay. So, ma'am, may tanong si Anis 23, sabi niya, Miss Jeck, paano kung may mental disorder or unable to verbalize ang patient? Okay lang ba ang caregiver or family ang i-ask?
Yes, I think so, sa part na yan. Pero, but as I've told you guys, let's focus not on the real scenario, but on the exam itself, okay? So, dito,
I think Miss Jeck,
natin,
I
okay?
think si Anis is just concerned about what if she goes to the ward? Alam mo yung ganun, yung tipong ganun. What if she goes to the ward and I have this patient who's mentally who has mental disorder and couldn't verbalize. Usually, guys, primary caregiver or family can be your source of information. And also, yourself as well, kung kunwari, kung physical assessment lang naman, pwede na kayong sumagot doon. Pero like, say, for example, of course, kung meron silang mga history, you can actually ask them. And I mean, like, the caregiver and the family. So, sabi pala ni Lynn Javier, actually, Lynn, oo, totoo to. Ma'am Jeck, this one is equivalent to Braden score dito sa KSA. Yes, actually. Braden score sa kids, ginagamit namin before, yes. And I think adults din, Braden score pa rin ba kahit adults sa KSA? Not sure.
Braden pa rin, yes, Braden.
Braden
pa rin sila doon.
Ayan. Na muna tayo, stretching muna. Kaya pa ba? Kaya pa. Biglang gano'n. Ako din nag-stretching. Kaya pa ba, guys? Ayan. Mag-hi lang muna ako. Mag-hi ako, Miss Jeck. Ayan. Sabi pa ni Exclusively Yen. Andyan si ate, si Mayora.
Ate Yen.
Ay,
Hello,
Mayora.
ate.
Kumusta ka dyan? Ayan. Si
Ate.
Exclusively Yen. Isa yan siya sa mga, tigasin talaga sa mga, malalakas dito ng mga YouTube vloggers. Ayan, si Miss
Si ate.
Yen.
Very
Tapos sabi
supportive din
naman
si
ni
ate.
Harold, oo, of course, of course. Ayan. Sabi naman ni Harold John, may question. Ang frequency po ng monitoring sa Waterlow, ma'am? Tatanong siya ng frequency. I believe, guys, eto ha, though I am not using Waterlow, but I think you can do this assessment every 12 hours. Kasi guys, like on our shift, like just in case, if your patient is just at risk, ang score niya is 10. You can do that one every shift. Like kunwari from the morning shift, you can assess it and then hand it over to the evening shift. However, guys, if it has like very high risk, it's on your prerogative na, guys, na kung kunwari sabi mo, kasi hindi naman siya magbabago abruptly. Alam mo yon yung ibig kong sabihin. Like kung kunwari, ngayon diagnose siya ng DM, hindi naman bukas agad, mamaya agad hapon, diagnose na siya ng stroke. Parang gano'n. Hindi siya yung parang mabilis ang pag-change. Unless na talaga na very high risk ng patient.
Yes. So I think guys, kung sana hindi tayo nagkakamali, upon our at the start of our shift, kasi 'di ba gumagawa tayo ng mga assessment sa pasyente natin. So at the start of the shift, I think kung 8 hourly, then every 8 hours. Kung 12 hourly, then every 12 hours. I hope. Pero, syempre, hindi pa rin natin alam kung ano yung protocol ng ibang hospital, di ba? So, it still depends.
Depende pa rin siya sa mga hospital. Kasi, depende pa rin sa ward. Like, if your ward is, kunwari nasa stroke ward ka, of course, you would be more keen on doing this kasi nga yung patient nyo nasa high risk siya category. Pero, syempre, as a nurse, we do our assessment and we judge by our assessment as well. So, sabi dito ni VJ, in our case po, sa dating hospital po sa KSA, we used Waterlow, then we changed to Braden for adult. Ganun. Kami din naman Braden. Ayan.
Braden
sabi
din kami
Harold,
sa Saudi.
Braden din. Ayan, okay lang ba, guys? Kaya pa?
Kaya
hello,
yan.
Hello sa inyo dyan.
Kaya yan.
Hello,
kaya yan. Kahit na 9 hours pa yan, kaya yan. Para sa RGN team. Kaya yan.
Again, guys, please don't forget to subscribe to Miss Jeck's channel. It's sweeter than funny. Please, guys, subscribe to her channel and watch her videos kasi very informative ang mga videos na ina-upload ni Miss Jeck. And katulad ko, hindi rin siya techie. So, pagpasensyahan nyo na yung mga namin, mga YouTube videos namin. But,
nagpa-practice pa lang kami, guys.
Oo, i-pick up nyo na lang yung mga guys, yung mga pwede nyong matutunan. Huwag nyo na masyadong i-judge yung mga sound effects and all. Okay? Kasi wala pa kami sa peak ng mga ganong klase. Okay, guys?
Basta ang lang
okay
namin,
lang ba? Kaya pa?
Ang pinaka-motivation namin, guys, na kahit papaano may matulungan yung mga videos namin. I hope na kahit papaano may maitulong sa inyo ba na mabawasan yung anxiety nyo, yung concerns nyo, yung ganun ba?
Oo. Kasi alam mo yon, Miss Jeck, nung time namin, we don't have this. We don't have, wala kaming mga, alam mo yung tawag nito, wala kaming mga group of, like, mga nagre-review or like mga nag-discuss sa amin na kahit like any other random information on how to become like an RGN. Ang tumulong lang sa amin dito is like yung mga ahead lang din sa amin. But like, to have this publicly, I don't think we have this before. And if there is naman mga nasa ibang lahi, so alam nyo yun.
So we're so blessed, guys, na meron na tayong YouTube, may YouTube tayo. Sa Google din, ako din, nakamit din ako ng mga, when I was in Saudi Arabia, nakamit din ako ng vlogger na talagang napaka-generous din na nag-share din sa akin ng mga review materials. Kaya, ano talaga guys, yung kumbaga we're just paying it forward also to you guys. So ngayon guys, let's continue with our scoring. So ngayon, let's say ang score nga natin ay 18. So high risk ang pasyente natin. So you already put the total score here, 18, and then you put on your signature. Now here, dito na natin i-inject ang ating plan of care, which is the Sskin bundle. So ngayon, sasabihin natin ngayon, since my patient is on high risk of developing pressure ulcer or skin damage, so we need to implement a nursing care plan that would prevent the patient from developing pressure ulcer. Okay? So, as you can see guys, kung titingnan nyo tong tong form na to, meron yun siyang part pa sa likod. Andito yung mga interventions para sa pressure ulcer, okay? Ito yung preventions niya. So it says here, if the patient falls into any of the risk categories, then preventive nursing is required. A combination of good nursing techniques and preventative aids will definitely be necessary. So dito na natin i-inject ang Sskin bundle natin. So guys, tip ko lang sa inyo is to familiarize yourself with this prevention and nursing care. Mattresses, bed, kasi pwede niyo siyang i-inject doon sa, as you discuss the Sskin form, you're going to inject all these informations into your form, okay?
Guys, hindi na namin i-discuss each one of it. Basahin nyo siya. Actually, straightforward naman siya. Sasabihin nga lang kung anong mattress yung gagamitin nyo, yung questions na gagamitin nyo, kung kailangan ba ng mga transfer devices. So, para hindi siya masyadong humaba. Anyways, you can read that one. It's straightforward.
Yeah. So, kaya nito, di ba ang pasyente natin, more than 80 ang score niya. So, dito siya nag-fall ngayon. Yung mattress niya ngayon ay anatomic support mattress. So, kahit or Nimbus, yung mga madali lang guys, yung madali lang ninyong maalala ba? So, kumuha kayo ng iisa lang. Example, pag ang score ko 15 over 15, so I should have Nimbus mattress. Ganun. So, kumuha ka lang ng tig-iisa guys na pwede mong i-inject doon sa Sskin bundle natin. Tapos, ito rin, no patient should sit. So, just kindly read this one guys. This one would help you a lot on how to discuss the Sskin bundle, okay? So, take home nyo na to guys, assignment nyo na to, okay? To familiarize yourself with these preventions, okay?
Assignment, i-check sa next episode. I-check sa next episode. Pag hindi binasa, ha?
Yung mattress, yung cushion, yung frequency ng repositioning ng pasyente, pain, nutrition, patient handling, yan. Skincare.
So, alam niyo na yan, guys. Kayo nang bahala dyan, ha?
Oo.
I-discuss ngayon ni
na natin.
Jeck.
So, ngayon,
diretso
ka agad. Diretso ka agad to. Tayo ngayon sa, sorry, Gail, ha? Tayo ngayon kaagad sa Sskin bundle. So, ito na yung Sskin bundle natin. So, let's go to page 18. Page 18.
Guys, hindi to, yung information na to, yung mga materials na to, pwede nyo siyang hanapin online. Mahahanap nyo siya online. Kung sakaling gusto nyo mag-print, gusto nyo mag-practice sa bahay, mapiprint nyo siya online. Hindi to sikreto, guys. Hindi to special na na information.
Guys, nasa to ha, nasa RCSI page lang to ha. Nandun lahat sa charts ito na category. Okay? Charts. So, you can print them all there. Okay? Bago kayo pumunta dito, kung wala pa kayo dito sa Ireland, please bring your printouts when you come here, okay?
Okay.
Para makapractice kayo. So, ito na yung Sskin bundle, guys. So, ngayon, bibigyan ka, kasi bibigyan niya kaagad kayo ng dalawang form, Waterlow. After ng Waterlow, Sskin. Ngayon, sabihin niya, okay, can you discuss to me the Sskin bundle? Okay, ngayon. So, ngayon, sabihin mo ngayon, ma'am, Gail, since we found out that you have you have a high risk of developing pressure ulcer or skin
Pressure
damage.
ulcers, yeah.
Yes. So we need to, like prevent this from happening. So we need to implement this SKIN bundle of care to prevent any development of pressure ulcers. So first, we're going to put on the date. So Gail, ang SSKIN bundle pala natin, Gail, ito yung mga approved evidences and practices. Sana nga yung Gail? So, ang SSKIN,
guys, ito,
as you know, S means, the first S means surface, and then the another S is skin inspection. And then the other one is K, keep patients moving. And then
if you check on the checklist itself, nandyan siya. Ayan, surface.
Yes.
Sorry, Ate Jeck, can you move it a bit? Yan. Skin inspection, keep moving, tas ayan na siya, meron pa siya. So may category every letter on that bundle.
So it's all here in the form actually. Tama ka, Gail. So yun. So yung SSKIN bundle natin, guys, these are best known evidence and practices for the improvement of pressure ulcer prevention. So this also improves patient care outcomes, okay? So ngayon, we are going to put on the we're going to put on the date and then the time that it was done. And then here in the surface, now in here we're going to mention, since you have a high risk of developing pressure ulcer skin damage, Gail, so I'm going to immediately refer to my client to my head nurse or client care manager, to my manager, to order this proper mattress and cushion for you. Yun. Babanggitin mo lang siya na i-refer mo yung case mo sa client manager nyo, so that the client manager can order this mattress and cushions for the patient, okay? So
Ate Jeck, pwedeng pa-zoom in ako para medyo klaro yung form lang po.
Okay na. Ito.
Ayan, para makita nila. Ayan. Ay, nakita nyo ba, guys? Nakalagay lang dyan is kung yung mattress ba is appropriate and functioning properly. So, kung appropriate siya, ilalagay nyo dyan. And kung merong mga protectors.
So, ngayon, guys, nabanggit mo na yun. So, nabanggit mo na yun, no, that you are going to refer, since you have a high risk of developing pressure ulcer, I'm going to immediately refer to my client care manager to order for the proper mattress, and we will make sure that it is appropriate for you and functioning correctly. And then we also have to make sure that you have an appropriate sitting and heel protectors. So, ang gagawin mo ngayon, guys, sundan mo lang talaga siya. Parang babasahin mo lang siya. Tapos, every time na nag-mention ka nun, lagayan mo siya ng tick. Iti-tick mo lang siya. Ticking lang ang gagawin mo dito. Okay?
Guys, balik tayo sa mattress, guys. Baka may magtanong dyan sa inyo, saan galing, anong mattress ang appropriate? You go back to your Waterlow, yung form nyo doon.
Yes.
Diba nag-discuss kanina yung mga Nimbus na mattress? Yun sila yung mga mattresses, just in case they would ask you. So, what is an appropriate mattress for this? So, yun na yung i-mention.
Yes, okay? Yes, tama. Tama, Gail. So, example, let's say, sa pasyente natin, naalala mo, may Nimbus tayo, diba? So, sabihin mo na, the mattress would be a Nimbus, ma'am. So, yun, babanggitin mo lang siya actually. Okay? Yun yung sinasabi ko sa'yo na pwede mo siyang i-inject. So, in the case of my patient, ma'am, we're going to order the Nimbus type of mattress, and we will make sure that it is appropriate, and we will make sure that it is functioning correctly. And then, appropriate sitting. Ito na yung cushion.
So, yan.
You'll
Para
order a
siyang
cushion
checklist,
for you.
guys, ha?
Yes, checklist lang siya actually. And then, we're also going to make sure that you have heel protectors. Yun. Tapos, check mo ulit, tick mo ulit. And then, sa skin inspection naman, we're going to make sure that as you can see here, guys, inspect skin at bony prominences every 2 to 4 hours. So ma'am, Gail, we will make sure that your bony prominences are inspected every 2 to 4 hours. So every 2 hours, I'll be checking for your bony prominences, which includes, ito na yun guys, which includes the back of the head, the shoulder, the base of the spine, the buttocks, the heel, and the toes. So i-inject niyo yun guys, yung mga pressure ulcer points, okay?
And so yun na nga. So if you conducted the skin ano bang infection? Kanina pa ako skin inspection. So say if you've done the pressure area check, if you it, then you just have to put a tick on it. And then there's this space there it says new redness new redness state site. Can you see it there?
Ito,
Ayan.
itong existing pressure ulceration stage and site. Yeah. Yeah, guys. So dito, guys, basically, ang naman natin dito sa pasyente is wala pang ulceration. Let's say wala pa siyang ulceration. Okay? So, all you have to do is just to, verbalize to the patient that every 2 hours, I'm going to inspect for your bony prominences, which includes the back of your head, the shoulder, the base of the spine, the buttocks, the heel, and the toes every 2 hours to make sure that you will not develop any redness on your skin. Ganun lang guys, ganun lang. Kumbaga, let's not make it, complicated. Let's make it very simple, okay? So ganun lang ang sasabihin natin.
Okay.
So
sa susunod na after no skin inspection, Miss Jeck.
So the pressure areas are checked already. So pressure areas checked. Yun yung mga nabanggit ko na mga pressure areas. Lagyan mo ulit siya ng tick. And then we'll move on to the keep moving na tayo. So in here guys, we are going to mention, and then we are also going to reposition you every 2 hours to relieve, especially if there's any redness on the skin already. So we will make sure that every 2 hours you are repositioned to your right side, and then after 2 hours on your left side, and then right after next 2 hours at the back. And then if you happen to be seated on a chair, I advise you to please at least move side to side, or at least you can stand up and pace around your room just to relieve the redness and to prevent any ulceration or any ulcers to develop. Okay, so dyan guys, ititik mo lang din right side, left side, back, chair, and then standing, mobilizing. So ganun lang guys, i-ano mo lang siya yung parang ano mo dito, parang health education lang kasi to parang health education lang ba. Sabihin mo lang sa kanya na every 2 hours, can you please if you can move on your own independently, please make sure that you reposition every 2 hours. If not, I will be with you and I will be turning you or changing your position every 2 hours. Okay? So, okay naman, Gail? Clear naman, Gail? Ang part na yun, Gail?
Oo. Yes, ate. Yes, ate.
So, ngayon naman, standing, mobilizing. So, ano mo lang talaga siya. Encourage mo lang siya na she shouldn't be, like lying lang or sitting lang. That every 2 hours at least, she has to move around. Okay? And then, incontinence naman, guys. In here, we are going to make sure, please ma'am, every time that you use the toilet, we should make sure that you are dry and clean. And you can also use some emollient creams to prevent dryness on that part. We will make sure that your perianal skin is healthy. So let's prevent any moisture to develop, okay? Ganun lang guys. So kung ano yung nakita niyo dun dito sa guys, yung sa prevention ng Waterlow, yun i-inject niyo lang lahat ng natutunan niyo dito, okay?
Yes, ganun.
Oo, i-inject nyo lang dito yung mga lahat ng natutunan.
After ng incontinence.
Ako sinabi ko lang, so with regards to your incontinence, ma'am, we will make sure that, you're always, we will make sure that you're always dry and clean. You can also use some emollient creams to prevent any dryness. And then, let's make sure that we will prevent any moisture to develop on your perianal skin, okay? Then let's move on to the nutrition. So in here, you can tell the patient that, we advise you to have your high protein diet. Dito na yung mga meals, high protein diet. We advise you to have your high protein diet to maintain your skin healthy. So, ganun lang guys. I-ano nyo lang.
And also guys, high protein diet to promote wound healing then. Say for example,
yes,
you're doing the SSKIN bundle with a patient who has pressure ulcer already. So, pwedeng kaya kasama doon yung education ng high protein diet, or if you're well hydrated, nakalagay dyan, drink bacon. If you're having supplements, kino-consider yon to prevent pressure ulcer. But if it exists, it is good na alam mga proper nutrition, proper education nyo to prevent pressure ulcer. Gets nyo ba? Please press 1 if you understood.
Yes. So, yes, maganda ang sinabi mo, Gail. So, you can have your, we will make sure that you have a high protein diet to maintain your skin's integrity or healthy, and to also promote wound healing. And you can also drink at least 8 glasses in a day, 8 glasses of water. And then we will also make sure that you have some supplements to be taken. Okay? Like vitamin E, ano pa bang mga supplements na maganda sa skin. So pwede rin kayong nun guys, mag-Google
research about it. Oo.
Research
si Mr. Google na, hindi baka kasi binigay na namin lahat, wala na.
Basta lang guys. At least may masabi kayo na alam niyo yun, yung hindi kayo not necessarily na nagbabasa lang kayo ng form. Alam niya na kung meron kang knowledge ba? Meron kang something na
ang gusto lang kasi nilang malaman is
kasi parang man
and I think they wanted to know if you know what you're doing.
Yes. So ngayon guys, so
they wanted to know kasi na kung kunwari sinabi mo yung SSKIN bundle, ganyan, alam mo nga kung ano yung mga categories na yan, but you actually know kung ano yung under ng nutrition. O sige, alam mo yung sa nutrition, pero you can't even discuss it. It only means that you just know it, but you have studied about it, but you haven't had any comprehension on the form. So yun lang yung gusto nilang malaman, kung alam mo ba talaga yung ginagawa.
Oo, correct guys. So, let's not complicate guys. Basta ang lang natin dito is, wag muna nating isipin yung real scenario. Ang iisipin muna natin ngayon is yung sa exam na mismo, para kasi later on sa real scenario naman, meron naman kayong magkakaroon naman kayo ng ng mga orientation yan. So most probably they will discuss all these things to you pag nasa na kayo, hospital setting na kayo. So as of now, I advise you na ang nyo muna ngayon, yung coverage ng thinking nyo muna ngayon is sa exam na muna. Yun na muna, yung scenario sa exam. Yung scenario sa real na job na natin, later on na yun, dito na muna tayo kung ano ang mamimit natin mismo sa exam. So, yun na yun, guys. So, yun na
First,
yun.
guys,
Nakumpleto
you
mo na. So,
missed that one.
I'm sorry, Gail? Gail?
Yeah, so as I sorry, I think concern on what we area na. But of course, yeah, we know that we are having this review, just we're having this topic or this kind of live stream, not just to let you be prepared or prepare you for the exam or for your adaptation, but also to prepare you paano nga ba talaga gamitin to pag nasa floor na kayo or pag nasa ward na
Yes.
kayo. Pero ang sinasabi
Oo.
ni Miss Jeck dito is we should not complicate things. We just have to focus on what is being offered to us. Alam niyo yun? But of course, you have to research on those details naman. Ang ibig lang namin sabihin is that just don't overanalyze things. Because pag nag-overanalyze ka na, hirapan ka ng makapag makabalik, biglang ganun. Si Anis 23, Miss Jack, at tanong. O sige, pasok tanong. Sige. Kung may tanong kayo, pasok.
Sige,
Comment sa
Q&A na
baba.
tayo, guys. Q&A na tayo.
Okay ka na ba dyan, okay ka na ba dyan, Ate Jeck, sa Red Skin Relief and Reverse
So dito, di ba umabot na tayo sa supplements taken, di ba? So ngayon, ilalagay mo lang ngayon yung ano mo dyan, yung signature mo, tapos lagay mo SN. Yun na yun. Yun na yun. Nakompleto mo na ang form.
Yes. O, di ba? Tapos na ang form.
Tapos na. Yun na yun.
Ayan.
Affix your signature and then lagay mo SN, then yun na yun. That's it. Tapos sabihin niya sa'yo, thank you very much.
Ang tanong ni Aniska sa inyo, guys, preparation is not just for the exam, okay? This is not just for the exam. This is not just for the adaptation. This is also applicable in general. Pero ang tanong ni Anis is, Anis talaga, parang star Anis. Ang sabi niya, sa exam ba, magbibigay sila ng situation or need lang po i-discuss ang forms? To be honest, depende. Because some assessors would give you a situation wherein you have two forms that needs to be discussed. Kasi magbibigay sila ng actual na pasyente, na sitwasyon na, ganito yung pasyente mo, ganyan-ganyan, tapos isa-score mo siya. Tapos ngayon, may score ka na. Paano mo i-fill out yung SSKIN bundle mo? Ganon. Meron namang iba, if, they're happy with how, ganon yung ginawa nila sa isang nurse, maybe sa iyo, sasabihin niya na lang, are you familiar with this form? Do you want to discuss it with us? What do you know about these forms? What are these forms for? Parang ganon. Tama ba, Miss Jack? Or may ma-add ka dun sa sinabi?
So, ano lang yun, guys. Kumbaga, sa ano na to, wala na siyang situation. Ano siya, kumbaga, kausap mo yung mismo, yung client mo. So lahat ng isasagot niya doon na mismo ang scoring mo. So wala na siyang something like that. Basta ang goal lang is you'll be able to know how to fill up and discuss the form. Yun lang naman. Yun yung ano nila, yung goal doon.
So basically, now that you know the form, now that you know the Waterlow, now that you understand SSKIN bundle, what you need to do now is just to practice and then read more about and understand yung sa second page ng Waterlow with the mattresses, if you have an assistive device, yun na lang yung mga gagawin nyo. Okay ba tayo doon?
Guys, may
parang matahimik sila. Tulala pa rin ba kayo, guys?
Guys, pag may questions, may may Facebook ako, pwede rin kayong i-add sa WhatsApp, ito yung pangalan ko.
Guys. So, ganito yun, guys. What we're having right now is just the live stream of Waterlow and SSKIN. However, now Miss Jeck is offering her Facebook. Nako, talagang dadagsain ito. She's offering her Facebook account to you guys if you have other questions, clarifications that we cannot discuss on this live stream or that we will not be able to discuss in this live stream. You can always send us a message. Ako, I'd suggest you comment it down on the Facebook, on my YouTube videos rather than sending me a direct message because I cannot see it. May ginawa si Facebook na hindi ko nakikita lahat mga messages. However, si Miss Jeck can answer your questions if you have other questions.
So message lang guys ha, message lang. I'll be more than happy to share naman kung ano ang natutunan ko. I'll be happy to share. Ito din, may isa pa akong page. Ito pwede din dito ha.
Ate, sorry, nakalagay ka sa private chat. So guys, as I've said, don't forget to please subscribe to Ate Jeck's channel. It's sweeter than honey. Please don't forget to subscribe to her channel. Kasi guys, mas nakikita namin yung nasa YouTube kasi magno-notify siya. Pag hindi kasi kayo friends sa Facebook, hindi siya magno-notify. Get niyo ba? Gets niyo ba yung sinasabi? Ayan. So guys, bago naman tayo, actually may mga hingan muna natin ng tips si Ate Jeck. Pero bago yun, gusto ko muna shout out. Shout out muna kasi eto sila guys, mga nag-comment ito sila sa previous nating episode ng RGN. So shout out to Hayes Ancheta, to Christine May Freo, Angel Santos, Rosemary Flores, Ivy Archua, I think I saw Ivy here kanina, and Mary Ann Raqueño thanks for watching the videos, the previous episode. And by the way, shout out pala, dito ka ba, Quavo? Hello, Quavo. Quavo is a friend of my housemate. So sabi, nanonood daw ng mga RGN episodes natin. So shout out dyan. Please press 1 kung nandiyan ka, magparamdam ka, okay? Kung nandiyan ka, magparamdam ka. So ngayon, Miss Jeck, bago naman natin i-end ang ating napaka-informative na topic today, would you like to have any tips? Eto siya, tips sa ating mga nurses kung paano nga ba talaga maging nurse sa Ireland? Paano nga ba talaga maging successful RGN? Tsaka paano mo nga ba narating ang tuktok ng tagumpay, Miss Jeck? Gusto talaga naming malaman yun. Gusto naming malaman yung mga naging journey mo para mo talaga maabot yung mga pagiging napakamatatag at grabe, turok ng tagumpay. Ayan, guys. Sige, hingin natin.
Guys, all I can say is, naiintindihan ko kayo na talagang mataas ang anxiety level pag nag-e-exam. So I was just like you na talagang yung hoping, kasi ayaw nating umuwi ng Pilipinas, ayaw nating bumalik sa country na pinanggalingan natin, guys, kasi once you did not pass on the retest, on the repeat, guys, bye-bye Ireland tayo, guys. Kaya yun talagang sinaksak ko sa utak ko, hindi ako babalik sa Pilipinas, hindi ako babalik ng Saudi. Kaya Saudi pa lang, guys. Hindi ako nananakot sa inyo, guys. I mean, this is just, a form of motivation to encouragement na it's very important to prepare ahead of time. Huwag tayong mag-study o mag-cram pagdating na dito sa Ireland. So, ngayon na nasa home country pa kayo, region of country ninyo, please, just like sinasabi nila, Miss Golda, lahat ng sa FNI talagang malaki din ang naitulong sa akin when I was still in Saudi Arabia and preparing for the exam. Kada may mga live streams, may mga talagang nag-a-attend ako. So, tsaga-tsaga na lang muna tayo, guys. Tsaga-tsaga muna tayo and don't
Katulad nga ng sabi.
Ha?
Sabi ko nga, Jeck, tis-tis muna kayo sa mga, tis-tis muna kayo sa mga itsura namin. Tis-tis muna. Pag nakapasa na kayo, okay na. Kahit huwag niyo na kaming panoorin, guys. Okay na. Basta lang makapasa muna kayo, ha?
Oo. Tapos
Ayun na nga.
guys, yun, study ahead of time. Don't cram when you come here para pag pumunta na kayo dito, medyo hindi kayo yung kasi pag highly anxious ka na, minsan mahirap nang mag-grasp eh. So at least pagdating nyo dito, maturuan na lang kayo ng how to handle the scenarios, ano yung mga techniques na pwede ninyong gawin. Medyo, alam mo yun, yung hindi masyadong stressful sa part ninyo. And, ang one thing is to jot down yung mga diseases, example sa diseases, simple definition, simple pathophysiology, tapos kahit meron mga 3 to 4 symptoms, risk factors, kung ano yung mga prevention, ganun. Basta lang guys, there's nothing more but to study and prepare ahead of time, and please don't be shy to reach out people na pwedeng makatulong sa inyo. Kasi you will never know kung sino makakatulong sa inyo kung hindi kayo mag-reach out. Marami akong mga nakilala na nag-reach out yung mga 2 days before the exam na lang, 1 week before the exam. Don't do that.
I remember. You know, we were talking about it. I remember. You know the one who sent us a message and then exam niya na kaagad bukas? I remember her. Yeah. So guys,
please don't do that.
Kaya nga lagi namin sinasabi guys, nandito naman kami. Pag hindi naman kami nakapag-reply, there are other people who are very willing to help. Kasi nga guys, hindi rin namin kaya lahat. Pero yun na nga guys, alam nyo yun, kailangan nyo lang mag-reach out because kapalan nyo na yung mukha nyo guys. As in
Yeah, guys, di na uso ang hiya ngayon ang mga nahihiya na pag-iiwanan. Kaya minsan reject ka or di ka ma-replyan. Basta message mo kung sino ang dapat i-message. Wala nang hiya.
Kasi minsan guys, kaya nga sinasabi ko lagi, we receive your messages but sometimes, minsan meron akong mini-message na, okay, I'll get back to you after, kunwari, duty ako, I'll get back to you. Pero guys, kunwari, tapos na yung duty, hindi ko na-replyan. Umaabot minsan ng mga days or even weeks na hindi ko ma-replyan. Just get back to me. Kasi nga, pag nakausap nyo, at saka guys, intindihin nyo na lang din minsan yung mga sagot namin na yes, okay, no. Kasi minsan madami talaga, hindi kaya. Anyways, ayan, sabi pala ni Nurse Harold. Ayan na si Nurse Harold. Kanina mo pa siya hinahanap. Ayan na. Nurse Harold, kanina ka pa hinahanap Ate Jeck.
Ito na pala
sabi niya, shout out daw, Mystery Idol. Ayan.
Buhay pa, 16.
Sana all parang Harold. Oo. Ayan. Shout out din pala kay Emma, watching from Chapelizod. Nandito lang sa Dublin, pero nanonood din. Ayan. Hi, Emma. How are you? Ayan. So, ayun na nga, guys. Watch out for our future episodes. Marami pa tayong mga upcoming episodes. I hope you found this topic very informative, and I'd like to take this opportunity, Ate Jeck, to thank you kasi you've been very helpful to me, to my channel. You've been very helpful to other nurses as well, and I know we're all in this together. I know that this is your passion, and you know that this is one of my passions as well, to help others and to actually share what we have.
Yes.
Yeah,
okay?
Of course. Oo naman. Kaya nga sabi ko lagi, I'm very thankful that I'm surrounded by, I've met you through FNI because I'm surrounded by these people, these motivated people, including Nurse Harold, who's watching now, na makatulong para sa iba. Hindi lang naman our YouTube channel, our Facebook pages are not just for publicity or for whatnot, but it's also, our main goal is to actually help others. Thank you. Yung, alam mo yun,
thank you,
Gail. Others. Kasi nga,
thank you din. Kasi,
we were on that spot before. I was on that same spot.
Kasi, nung nasa Saudi din ako, you've been very patient. Kayo nila, Miss Golda. Alam mo yun, kasi nakapagtanong din ako sa'yo, nagre-reply ka rin talaga. So, I told myself, pag ako naging successful ako, awa ni Lord, maging RGN ako, I will really pay it forward. So, ito na yun, dream come true na yun para sa akin, guys, that kahit papano, I'm paying it forward also to others na makatulong din kahit papano. So I hope that you're going to, uh, you will subscribe to Gail's YouTube channel and mine. I hope na
And subscribe
may
to
makuha
Ate
kayo,
Jeck's channel.
may makuha kayo ng mga, yung mga information na pwedeng makatulong sa inyo for your transition here. And abangan nyo yung mga sessions ngayon ni
And
Gail
guys,
kasi talagang this is meant to help you.
This is actually, yes, yes. And guys, yun na nga sinasabi namin. We were able to pay it forward. I really hope that when it's your time again to pay it forward, you take that opportunity to help others as well. Kasi nga guys, alam nyo yung feeling ng walang, hindi mo maintindihan kung ano yung topic. Alam mo yung feeling na gulong-gulo ka, paano ba mag-apply sa NMBI. So you were on that spot. And then when someone asks you in the near future, you will be on our spot now na nakaka-receive ng mga questions on how to actually apply for NBI. Paano, ma'am, ano ba yung GARDA vetting? Ano po ba yung AWS? Yung mga ganon. So I hope you take that opportunity to help others as well. Actually, may tanong dito si Nurse John Sia. Sabi niya pa, kailan magtuturo si Nurse Harold? Ayan, Nurse Harold. Ikaw
I-book mo na yan si
talaga.
Sir Harold.
In
I-book mo
demand
na,
si
Gail.
Nurse Harold.
I-book
Kaya
mo na
nga,
si
pero
Sir
sabi ni
Harold.
Nurse Harold, we are willing to help. We are willing to help po. Basta alam natin, wag nyo lang i-ask, ba't nawala siya? Ayan, may hugot na naman si Nurse Harold.
Oh my God, may
Ayan,
hugot
guys.
siya.
So,
Sino
guys,
yung nawala?
ayan, bakit kasi tayo iniiwan? Ayan. Anyways, guys, thank you so much for this opportunity to help you and to teach you guys. It's always a pleasure for us to help you. And I know Miss Jeck is one of those individuals who's always been there to give us a hand. And like si Miss Jeck talaga yung, kasi we share the same passion eh. We like teaching, we like helping others. Kaya nga, I wanted to be surrounded by these kind of. Anyways, you guys, we really enjoyed today. Did you enjoy today, Ate Jeck? It's a different platform
yes,
kasi I know you've been
I enjoy a lot.
active privately.
Yes, I enjoyed a lot. At saka, ano talaga, Gail, masarap sa pakiramdam na alam mong may natutulungan ka. Kahit papano, kahit sa maliit na bagay lang ba. Maliit na bagay lang to kung tutusin, pero it brings you joy and happiness na kakaiba. Ang kakaiba.
Oo naman. Oo, ayun. O, di ba guys, palakpakan naman dyan.
You're welcome. God bless.
Thank you and God bless. We'll see you on our next episode, okay, you guys? Watch out for my advertisements and watch out for my posters, okay? Thank you so much. Bye-bye.
Gail. Thank you, Gail. Bye-bye.
Thanks, Ate Jeck. Bye-bye.